Almost every insurance agent who sits across from a senior and opens a Medicare conversation will tell you the same thing. The $0 premium plan is the smart choice. You keep your doctors, you get extra benefits, and you pay nothing every month. That is the pitch delivered to the 35 million Americans currently enrolled in Medicare Advantage. 35 million people, more than half of everyone on Medicare. And here is what almost none of them were told when they signed the enrollment form. The agent who recommended the $0 plan was paid up to $694 to do it. That is the maximum commission payment the Centers for Medicare and Medicaid Services allows a Medicare Advantage insurer to pay an agent for a single new enrollment in 2026. The agent does not have to disclose that payment. There is no law that requires them to. And here's the number the brochure does not print. The average maximum out-of-pocket exposure for a Medicare Advantage HMO enrollee in 2026 is $4,636. Not the statutory ceiling, the legal maximum is $9,250. $4,636 is the average. The plan that advertises $0 per month has a ceiling. The ceiling activates on the day your health changes. Here's the part that matters most, and it is the part almost no one explains. The choice between Medicare Advantage and a traditional Medigap supplement is not a choice you can revisit freely. There is a window, a specific legal window, that opens during your first year of Medicare and closes on a schedule. After it closes, insurance companies in most states are permitted to deny your Medigap application based on your health history. The window does not reopen when you get sick. It does not reopen when the bills arrive. In the next 20 minutes, I'm going to show you the specific dollar amounts that reveal when a $0 Medicare Advantage plan stops saving money and starts costing more, the enrollment window that most beneficiaries close without understanding what they gave up, and the one legal escape route that still exists in certain states, a route the industry has no financial reason to advertise. Here is exactly what this video covers. First, the Medigap Initial Enrollment Period, the legal window that opened the day your Part B coverage began and that most people allow to close without understanding what they gave up. Second, how agents are paid up to $694 per Medicare Advantage enrollment and what that payment structure means for the advice you received. And third, a legal provision currently available in 5 states that gives Medicare Advantage enrollees a second guaranteed issue window, one that closes before most people know it exists. This channel focuses on insurance industry practices that affect Americans in retirement. The research behind this video is sourced entirely from data published by the Centers for Medicare and Medicaid Services, the Office of Inspector General of the Department of Health and Human Services, and the Kaiser Family Foundation's Medicare Research Division. 3 years ago, Linda was 65 years old, recently retired from 28 years as an elementary school librarian in Dayton, Ohio, and sitting across a kitchen table from an insurance agent who had come recommended by a neighbor. Linda was healthy. She had mild arthritis in her right hip managed with over-the-counter medication. Her blood pressure was slightly elevated but controlled. The agent showed her 2 options, a Medigap Plan G policy at $164 per month, $1,968 per year, that would cover virtually all of her Medicare cost sharing above the annual Part B deductible of $283. Or a Medicare Advantage HMO plan at $0 per month with a dental benefit included and a network that included her existing primary care physician. Linda chose the $0 plan. The math appeared straightforward, nearly $2,000 a year staying in her pocket, going toward her granddaughter's college fund. Over 3 years, that is $5,904 she would not have spent on premiums. She signed the enrollment form. The agent was gone in 40 minutes. In the fall of her 3rd year on Medicare, Linda's hip arthritis progressed to the point where her orthopedic surgeon recommended a full hip replacement. The surgery was approved through prior authorization, completed without complications. She spent 6 days in the hospital at a cost-sharing rate of $325 per day. 6 days, $1,950. She then transferred to a rehabilitation facility for 35 days. Days 1 through 20 cost her nothing. Her plan covered them. Days 21 through 35, 15 days at $175 per day, cost her $2,625. Total out-of-pocket for that year, $4,575. Under Plan G, that same year would have cost her $2,251, the annual premium plus the Part B deductible. Every other bill would have been $0. The following March, Linda applied for a Plan G policy through a carrier that serves Ohio. The application included a standard health questionnaire. She answered honestly: recent hospitalization, recent rehabilitation facility stay, surgical procedure within the prior 12 months. Her application came back denied. She applied to a second carrier, denied again. Ohio does not have a birthday rule. There is no state law that gives her a second guaranteed issue window. The carriers were within their legal rights to decline her, and they did. The mechanism is not complicated. What makes it effective is that it is invisible until it matters. When a beneficiary enrolls in Medicare Part B, federal law gives them a 6-month window during which any insurance company that sells Medigap policies in their state is required to sell them any plan at the same premium charged to a healthy applicant. The insurer cannot ask health questions, they cannot deny the application, they cannot charge more based on a prior condition. This is called guaranteed issue, and it applies without exception during this period. The period is called the Medigap Open Enrollment Period. It opens on the first day of Part B coverage, it closes 6 months later. After the window closes, guaranteed issue ends in most states. The applicant does not lose the right to apply for Medigap. They lose the right to be accepted without medical underwriting. From that point forward, insurers can ask about health history. They can deny coverage. They can approve coverage with riders excluding conditions related to prior health events. They can charge higher premiums based on health status. In approximately 35 states, there is no mechanism that forces a carrier to accept an applicant who applies for Medigap outside a guaranteed issue window. Here is the structural question that arises from this design. Who benefits from a system in which the only window for guaranteed Medigap enrollment corresponds exactly to the period when the beneficiary is most likely to be healthy, and in which the insurance industry's dominant product during that window is a $0 plan that keeps the beneficiary out of Medigap? The commission structure is part of the answer. When an agent enrolls a beneficiary in a Medicare Advantage plan, the insurance company pays them up to $694. That is the maximum fair market value established by the Centers for Medicare and Medicaid Services for calendar year 2026 in most states. In California and New Jersey, the maximum is $864. In Connecticut, Pennsylvania, and the District of Columbia, the maximum is $781. In year 2 and every year after, as long as the beneficiary remains enrolled, the agent receives approximately half the initial payment, roughly $347, as a renewal commission. The commission resets at the full initial rate if the beneficiary switches to a different Medicare Advantage plan. Linda is now 68 years old, enrolled in a Medicare Advantage plan with a maximum in-network out-of-pocket of $4,636, and she cannot get out. The agent is not required to disclose this payment. They are not required to explain that the guaranteed issue window will close in 6 months. Their legal obligation is to recommend a plan that is suitable for the beneficiary, but suitability does not require disclosing the mathematical implications of the lock-in as the beneficiary ages. And the consequence is this. The beneficiary who chose the $0 plan at 65 discovers at 68 or 70 or 73 that the plan they cannot exit now has a cost ceiling $4,636 higher than the plan they could have entered at 65 for $164 per month. Let me show you exactly how this plays out for two different people. Robert is 72 years old and retired from a 23-year career as a civil engineer outside Phoenix, Arizona. He enrolled in Medicare Advantage at 65 for the same reason most people do: a $0 premium, coverage for his existing physicians, and a fitness benefit his wife used twice a week. For 4 years, he was healthy. His annual cost sharing averaged under $400 per year. He was saving approximately $1,550 annually compared to a Plan G premium. After 4 years, his accumulated advantage was $6,200. By 69, he had a diabetes diagnosis and $1,200 a year in cost sharing. Still ahead on paper, but narrowing. At 72, Robert's cardiologist recommended a cardiac catheterization procedure. The procedure required prior authorization from his Medicare Advantage plan. The plan denied the initial request, citing insufficient documentation of medical necessity. His cardiologist submitted a peer-to-peer review, a process where the treating physician speaks directly with the plan's medical reviewer. The authorization was approved 11 days after the initial denial. Robert's cost sharing for that year, including the catheterization and follow-up appointments, was $2,300. When Robert applied for Plan G, he was denied. The insurer cited his diabetes and cardiac history. Arizona has no birthday rule. His $9,000 in accumulated premium savings now sit against a single-year maximum exposure of $4,636. Carol is 66 years old, a retired middle school teacher from Sacramento, California. She enrolled in Medicare Advantage at 65. At 66, before her second year on the plan was complete, She heard from a friend who worked in insurance about a provision in California law that most Medicare beneficiaries have never encountered. California has a birthday rule. Under California law, Medicare beneficiaries have a 60-day window that begins on their birthday each year, during which they can switch from their current Medigap plan, or in certain circumstances from Medicare Advantage, to any Medigap plan of comparable or lesser benefit from any carrier in the state, without medical underwriting. The insurer cannot ask health questions. They cannot deny the application based on health status. Carol's birthday is in April. In the April window of her 66th year, while she was still healthy, she applied for a Plan G policy through a carrier that serves her area. Her monthly premium is $172. Her annual maximum out-of-pocket is $2,251, regardless of what her health does. Carol has not had a major health event. She cannot know whether the switch saved her money, but she knows that her worst possible year now costs her less than half of what her worst year in Medicare Advantage could have cost her. She made the decision before she needed it. That is the only window that was available to her, and she used it. Here's what to do with the information in this video, in order of the time you have to act. The first action is to determine whether your Medigap Initial Enrollment Period is still open. If you have enrolled in Medicare Part B within the last 6 months, you are currently inside the guaranteed issue window. This is the most consequential piece of information in this video for anyone in that position because the window is closing on a fixed schedule. The Medigap Initial Enrollment Period opens on the first day your Part B coverage is effective, not the day you applied, not your 65th birthday, but the effective date of Part B. It stays open for exactly 6 months. During those 6 months, any insurance company selling Medigap plans in your state must offer you any plan they sell at the same premium a healthy applicant would pay, with no health questions and no possibility of denial. After those 6 months, that right is gone in most states. If you are currently enrolled in Medicare Advantage as your first Medicare choice, and you are still within 6 months of your Part B effective date, this is the window to compare your options before the comparison becomes theoretical. A Plan G policy for a 65-year-old ranges from approximately $140 to $190 per month, depending on state and carrier. That monthly premium buys you a maximum annual out-of-pocket of $2,251, the premium plus the Part B deductible, regardless of what your health does for every year you remain enrolled. The second action is to identify whether your state has a birthday rule or any other annual guaranteed issue provision. As of this video, 5 states have birthday rule legislation in effect: California, Oregon, Idaho, Illinois, and Nevada. In birthday rule states, Medicare beneficiaries have a window, typically 60 days, that begins on their birthday each year, during which they can switch from a current Medigap plan to a plan of comparable or lesser benefit from any carrier in the state without medical underwriting. In some of these states, the rule also applies to beneficiaries switching from Medicare Advantage to Medigap. The rules vary by state and have been evolving. To find the current provisions in your state, go to your state insurance commissioner's official website and search for the phrase Medigap Guaranteed Issue or Birthday Rule. This search will return the current regulations and eligibility criteria. The window matters only if you act during it. If you are in one of those 5 states, here is how the window works and what to do with it. In each of these states, your birthday triggers a 60-day guaranteed issue window each year. You can switch from Medicare Advantage to any Medigap plan of comparable or lesser benefit from any insurer in your state, without answering a single health question and without possibility of denial. This is a state insurance regulation, not a federal rule, enacted because 6 months of guaranteed issue at 65 is demonstrably insufficient protection across a 25 to 30-year Medicare enrollment. Contact a licensed insurance producer in your state during your birthday month, invoke the birthday rule, and apply for Plan G on a guaranteed issue basis. Time the disenrollment from Medicare Advantage to avoid a coverage gap. The birthday rule applies only to plans of comparable or lesser benefit, and state-specific eligibility details vary. Verify the current rules at your state insurance commissioner's website before applying. For Medicare Advantage enrollees in states without a birthday rule, there is ongoing legislative activity. Several states have introduced birthday rule bills in the last 2 years. Check your state insurance commissioner's website annually. The expansion of guaranteed issue provisions outside the initial enrollment period is one of the few areas of Medicare consumer protection where the trend line is moving in the direction of the consumer. Here is the number this video was built around. The gap between Medicare Advantage's average maximum out-of-pocket exposure and Plan G's annual ceiling is $2,385. That is the distance between the $0 plan and the plan that costs $164 a month. In the year you need care most, the plan marketed as free costs $2,385 more than the plan you passed over. If this video covered something you were not aware of, consider subscribing. There is more in this series. The next video examines another part of the insurance market where the same structural pattern appears. A product designed for retirees, sold through the same distribution channels, with costs that are only fully visible years after the contract is signed. That video is next. If you have a parent, a sibling, a spouse, or a neighbor who is approaching 65 and making their Medicare decisions for the first time, or who is already enrolled in Medicare Advantage and has never heard of the Medigap Initial Enrollment Period, send them this video. The decision about Medicare coverage is made once. In most states, it cannot be undone after the first year without passing a medical exam. The information in this video takes 20 minutes. The consequences of not knowing it can last for decades. I will see you in the next video.